Good afternoon, everybody. Thank you again for joining us for this briefing. I want to start by updating you on some of the key statistics in relation to the virus in Scotland. As at 9 o'clock this morning, I can confirm that there have been 12,226 positive cases confirmed, which is an increase of 169 from the figures reported yesterday. A total of 1,720 patients are currently in hospital with either confirmed or suspected cases of COVID-19. That is an increase of 54 from yesterday. A total of 99 people last night were in intensive care with confirmed or suspected COVID-19, and that is no change since the figures yesterday. I'm also able to confirm today that since the 5th of March, a total now of 2,780 patients who had tested positive and been hospitalised for the virus have been able to leave hospital, and I wish all of them well. Unfortunately, though, I also have to report that in the past 24 hours, 5 deaths have been registered of patients who had been confirmed through a test as having the virus, and that takes the total number of deaths in Scotland under that measurement to 1,576. I'd ask you to bear in mind, though, that today's figure might be artificially low due to the lower levels of death registration that we know takes place at weekends. And as always, I want to stress that these numbers are not just statistics, and we should never ever view them as such. They represent unique and irreplaceable individuals who are being mourned and missed by their loved ones. So I want to send my deepest condolences again to everyone who is coming to terms with a bereavement as a result of this virus. I also want to thank again our health and care workers. The entire country continues to appreciate the extraordinary work that you are doing. Now, I have one issue that I want to update you on today. As you know, Thursday this week is the date by which we must review the current lockdown measures. I said already that it is very unlikely that any change this week will be possible. Although we're making real and significant progress, and that is definitely the case, the numbers still being infected by the virus and the all-important R number remain too high right now to make any meaningful change without risking the virus running quickly out of control again. We also know, as we see on Sky today, that care home transmission continues to be a very significant challenge, and the Health Secretary will say a bit more about that shortly. So all things considered, and while, let me stress, decisions are yet to be formally taken, it is very likely that on Thursday I will be asking you to stick with lockdown for a bit longer. Now, I know you understand why that is the case, but I also know it is really hard. And I know that even as you comply with these measures, you do want to see light at the end of the tunnel. So today and tomorrow, building on the paper we published a week and a half ago, I want to share with you some of the work we're doing to make sure that we will be in a position to make changes to the lockdown restrictions just as soon as the evidence tells us that it is safe to do so. Tomorrow, I'll set out our current assessment of levels of infection and the R number, and also in general terms, the possible changes that the Scottish Government will be considering ahead of the next review date of the 28th of May, as we do try to get a degree of normality back into our lives while being careful still to suppress the virus. This is work we will, of course, be seeking to align as far as possible with the other UK nations. But as I've said before, our primary task is to make sure that we are making the right decisions at the right pace for Scotland. Now, that is what I will set out tomorrow, but today I want to outline what will be a key part of the approach we take when we have sufficiently suppressed the virus and are able to start moving into the next phase. And that is called the Test, Trace, Isolate approach, or TTI for short. Now, in summary, TTI involves anyone who has symptoms indicative of COVID-19 immediately isolating themselves, as everybody is meant to do right now, quickly getting in touch with the NHS to arrange a test, and also sharing details of the people that they've been in contact with. Professionals called contact tracers then get in touch with those contacts to advise them to isolate for 14 days, And if any of them develop symptoms, they get tested and the process starts again with their contacts. It is all about breaking the chain of transmission of the virus, but without all of us being confined to our homes all of the time, as is the case right now. Now, we've just published a short paper outlining this approach in more detail, and I encourage you, if you are able to read it at www.gov.scot. But I wanted to set out a few key points today, I suppose, to get you thinking about it. And the reason I'm really keen for you to think about it is this. A test, trace, isolate approach will only work if you, the public, are willing to do what we ask of you. So it's really important to start building your knowledge of and confidence in such an approach now as part of that grown-up conversation you know that I'm keen to have. The initial key point I want to make is that a successful TTI approach depends on us first suppressing the virus to as low a level as possible. If infection rates are too high, or if they get too high again in the future, the number of people with symptoms and who will need tested could overwhelm the system, even with a vastly expanded testing capacity. Second, TTI will be a key part of our approach, but it will not on its own keep infection rates down or the R number below 1. It's not a quick fix or a magic solution. It will have to be combined with continued physical distancing, rigorous hygiene and the appropriate use of face coverings. And crucially, it will mean you, the public, knowing exactly what it is we're asking you to do and why we're asking you to do it and being prepared to do it. That means if you have symptoms, you need to recognise them and be willing to isolate, to contact the NHS and get tested, and also be prepared to share details of anyone you've been in contact with. And for all of us, it will mean being prepared to isolate for 14 days if we are contacted and told that we've been in close proximity to someone with the virus. And that, of course, could happen multiple times with significant disruption to our lives. We also know that some people will need support to isolate, and we're considering how we can provide that, drawing on the arrangements that are currently in place for the shielded group. It's also why, as you will see if you do read the paper, we're calling this approach in Scotland test, trace, isolate, support. We're also making the other preparations now to be in a position to start delivering an enhanced TTI approach by the end of this month. Firstly, that means continuing to expand our testing capacity. You'll recall that I told you on Friday that by the middle of this month, we expect to have the capacity to do 12,000 tests per month in Scotland. Our initial estimate, though it's important to stress this is still being refined, is that we will need to get to around 15,500 tests a day just to support TTI. So it's very clear that continued ongoing expansion will be needed to meet all of our testing requirements. We also estimate that we will need up to 2,000 additional contact tracers to do the work that will be required. We're also building a digital system to make sure as much of this process as possible can be automated. Now, you might also have heard talk of an app as part of TTI, and I want to address that briefly too, because that's separate to the kind of digital approach that I've just mentioned. The kind of app being talked about, a proximity app, would operate on Bluetooth technology. If you download it and then you tell it that you have symptoms, it would automatically alert anybody that you've been in close contact with, as long, of course, as they have also downloaded the app. The development of this app in the UK is being led by the UK government, and we're seeking to maximise Scottish Government involvement in it. We believe it could be a very important part of a TTI system, but as an enhancement, it's important to be clear that in Scotland we are not building our whole system around that. We know that the success of an app like that will be dependent on high take-up by the public, and that in turn will depend on building confidence in the technology and in the use of data. So we want to do that very carefully indeed. So I hope today, albeit very briefly, I've given you a sense of what TTI involves, because it's something you will increasingly be hearing talked about. And we will give updates on progress in further detail in the days and weeks to come. But this will be an important tool in our efforts over the next few weeks to get some normality back into our daily lives. So please, if you can, do take the time to read the paper, which, as I said earlier, you will find on www.gov.scot. My last point for now is this one. The work I'm sharing with you today and will share with you tomorrow is for the future. And the hard fact is that we will only be in a position to implement it if we continue to suppress the virus now. So I ask all of you to please stick with the lockdown rules. Over the weekend, I received quite a lot of emails from people worried that the roads were busy again and that there were too many people on the streets and in parks. I have to be honest with you, I share that concern, though don't get me wrong, I fully understand the frustrations that all of you are feeling. But in a few weeks, I desperately want to be standing here at this podium telling you about the steps we are able to take to get back to a semblance of normality. And my big worry is that if we ease up now, I won't be able to do that. So please stay at home, except for essential purposes like shopping for food or getting medicines. Stay 2 metres apart from others when you are out for essential purposes. And please don't meet up with people from other households. And if you're displaying symptoms or anyone in your household is displaying symptoms of COVID-19, then please completely isolate and don't even go out for essential purposes. What I'm asking you today is please make sure we keep that light at the end of the tunnel on. And let's all keep making sure that it gets brighter with every single day that passes. Please don't risk extinguishing that light by easing up too quickly. So thank you very much for your continued compliance, and tomorrow I will share a bit more with you about the current state of the virus and what we might be able to consider in the weeks to come. But for now, I'm going to hand over to Professor Jeane Leitch, our National Clinical Director, to say a few words, and then the Cabinet Secretary for Health will say a little bit about care homes. Jason.
Thank you, First Minister. It is universally agreed by the clinical science, including the World Health Organization, that the first thing you have to do in this pandemic is control the pandemic. And the First Minister has made it clear that for now, nothing changes. We're asking you to stay at home to do precisely that. However, it's also agreed that one of the steps we will have to take as a country is to introduce that test, trace, isolate system. And I would just emphasise the necessity for our National Health Service, our laboratories, our military partners and everybody else, particularly in that testing phase. Everything they've done in the last few weeks has been astonishing to get those numbers up, but we are asking more of them now. We are asking for more. The tracing is very, very familiar to our health protection teams around the country. They already do that for a number of infectious diseases. They have done it as part of their training and they will continue to do it. But they, again, will have to step up. They will need new staff. They will need new people to help them with that. And we're putting that in place in the next few days and weeks. And then finally, the isolating and support doesn't just need the professionals, it also needs you. It will need you to help friends, families and neighbours to help them. And those who can't get that support, we will, as the First Minister said, help with that support. But it's not something we're doing lightly. We're asking people to do new things, and we will be very clear about what we're asking you to do and when we're asking you to do it. Thank you, First Minister.
Jason, I'll hand over now to the Health Secretary.
Thank you very much. I want to do two things briefly this morning. Firstly, to give those of you an update on the situation at Home Farm Care Home in Portree and the work that has been undertaken there and is ongoing there, and then to touch very briefly on all the areas where we are providing additional support, both clinical and in other ways, to the care home sector. Let me start by saying that my best thoughts and good wishes go to all those residents and staff at Home Farm Care Home and in other care homes who have tested positive for this virus. At Home Farm, all residents have been isolated to their homes and medical assessments are underway, led by the local GP and advanced nurse practitioner. Led by our Director of Public Health, I'm sure you will recall that we have given our Directors of Public Health a very key role in providing clinical intervention, direction and support to our care homes. Assessments have been carried out, a mixed discipline support team is in place, and the Care Inspectorate will, I expect, undertake their first visit to that care home today. In addition, the mobile testing unit is in place and contact tracing is in hand. In terms of the overall support and guidance that we have offered to the care home sector, both the private sector, the independent part of care home sector, and the small number of care homes run by our local authorities. Starting from that clinical guidance I've spoken about before on the 13th of March, which offered very clear advice about how to try to break the transmission of the virus in care homes and prevent its entry into care homes. We have continued to provide clinical support through our primary care teams, now with that leadership of our public health directors, ensuring that all the clinical support that is needed to each individual care home is provided and is provided quickly. We have acted, as you know, to intervene and top up on the supply of PPE where providers' own PPE supply chain was not being robust enough, and we continue to do that, including where it's needed direct delivery of PPE. We have acted too to make sure that care home staff have not only the PPE that they need to do the job that they are undertaking, a very important job, but also that they have the training and the confidence in that training in terms of infection prevention and control. We've also, from the date of our first opening of the call to returners to our NHS and to social care, received just under 20,000 volunteers wishing to come back. Just under 3,000 of those have previous experience in social care. We've already, having done all the pre-employment checks and so on, deployed 234 of those individuals into the sector and have 305 ready to be deployed when we are told that they are needed, and have moved NHS staff in some instances into that area too. And finally, on testing, as you know, we have steadily increased the degree of testing that is available to social care staff, but also to residents in care homes and to new admissions to care homes. And as the First Minister said on Friday, we have undertaken from this week enhanced outbreak investigations in care homes where all residents and staff are offered testing, whether they are symptomatic or not, and in homes where there has been a confirmed case, including looking at where there is a chain of care homes, perhaps owned by the same provider, to ensure that there is not staff transfer between one care home and another. And finally, sample testing in care homes where there have been no cases, but so that we can ensure adequate surveillance of the situation in those care homes. All of those and anything more that we believe we need to do in order to support and protect the residents and the staff in care homes, we've undertaken and we are open to do. This is an area of very close focus and importance to me, to the First Minister, to all of us in health, to ensure that the residents of our care homes have all the clinical and other support that they need, and the staff are equipped to do the job that is so vital and that they do so very well.
Thank you, Health Secretary. I'm going to move straight now to questions from journalists. First up is Ewan Petrie from STV.
Thank you, First Minister. First Minister, does today's announcement amount to an admission that it was wrong to abandon the policy of testing and tracing back in early March? And do you now regret that policy, given that it's been shown to have worked in other countries?
No, it's emphatically not that. And in terms of my feelings about what we've done and not done, we have done the best we can and taken the best decisions based on the best possible evidence at every stage of the process. In due course, all countries will look back and critically and very openly assess the things we did and the things we didn't do in order to learn lessons. We have required to build up our testing capacity in order to expand the testing we're doing. We will have to expand that capacity further in order to implement a test, trace, isolate approach. One of the things, of the many things I said today that is really important to understand is that test, trace, isolate is not some kind of quick fix. It doesn't work on its own to either get infection rates down or keep infection rates down. It certainly will not in and of itself keep the R number below 1. It's an important tool used in combination with continued physical distancing, continued hygiene, use of face coverings, probably us continuing to some extent to limit the contacts we have with people outside our own households. And as part of that combination, we believe it has an important part to play. But right now, and since we went into lockdown on the 23rd of March, what we are doing and what is working to suppress this virus is the compliance with all of the restrictions that people are living with right now, and that remains important. All that we're talking about today about the future only becomes possible to implement if we get levels of infection even lower than they are now and get that R number further below 1. So that requires everybody to continue to do what we're asking you to do, however difficult I know that is. Lisa Summers from the BBC.
Say that when the test, trace and isolate system is fully rolled out, you want to be doing 15,500 tests a day and tracing contacts of positive cases rather. Do you know when you're expecting to be able to do that? And is that the point when you would be able to lift any kind of lockdown measures?
Well, let me be clear. In a test, trace, isolate approach, we have to be able and want to do as many tests as is required. The 15,500 is what we estimate would be required, making certain assumptions about the level of infection. But if levels of infection rise again, so too with the number of tests we would need. And the point I'm making and why it can't operate in isolation is that you would get to a point, a bit like we've been saying, we can't allow this infection to overwhelm our NHS. Equally, when we go into this next phase, it will be important that we don't allow it to overwhelm the capacity of a test, trace, isolate system. So we are working on the capacity we believe we will need based on certain assumptions. This work is underway in terms of increasing the testing capacity. Health boards are already looking at how they increase their contact tracing capacity, and we will also be looking at that on a national level with the aim, as I said, again, based on the estimates that we have at the moment, that we will need to have an additional up to 2,000 contact tracers. Now, as I said in my opening remarks, this is ongoing work and we'll give progress reports as we go, but we want to be in a position to have an enhanced TTI approach ready to be implemented from the end of May. Now, your question, is that a requirement of moving into the next phase in terms of changing some of the lockdown restrictions? It's not the only factor that we take account of, but going back to a point I've made many times that Jason made a few moments ago, we must continue to suppress this virus. It's not simply going to go away. Right now, we're suppressing it through the very strictest version of lockdown. As we start to change that, the other things we do to suppress it will become even more important. Now, some of that will be social distancing, hand hygiene, wearing face coverings, continuing to be careful about who we come into contact out with our own homes, but some of it will also be through this TTI approach. So it's about how we get the right mix of measures to have confidence that we can keep the levels of infection as low as possible and, crucially, keep that critical R number as far below 1 as possible, because that's how we keep the virus in decline. As soon as it creeps up to 1 again, and certainly as it gets over 1 again, that's when it starts to run out of control. As I've said many times before, none of this is straightforward. None of this is simple. There are a whole variety of very complex and difficult judgments and uncertain judgments that have to be made there. But we need every tool in the toolbox to give us the best possible chance of getting back to some kind of normality, even if it's not, normality as we knew it before the 23rd of March, while continuing to keep this virus under control, because that is the prerequisite, keeping the virus under control and stopping it doing the damage that we know it's capable of doing. James Matthews from Sky.
Thanks very much, First Minister. You often say that your conclusions and what you do is necessarily tailored towards Scottish interests, and which is fine, clearly. But Boris Johnson, he appears to be shaping up for a big reveal on Sunday, talk of a timeline for a return to work for business, etc. You appear from your remarks today to be quite far apart from him on that. Can you tell me how far?
I don't necessarily say we're terribly far apart. All I want to focus on is taking the right decisions in the right order at the right pace to protect the people of Scotland from this virus as best as I can. I'm pretty sure he has the same considerations in mind. I guess we both want to get back to as much normality as possible, as quickly as possible, but I am clear, and I've heard him say this many times, that we must avoid a resurgence of this virus, principally because of the lives that would cost, but also, of course, because that would do even greater and more long-lasting damage to the economy. So we will both continue to take these decisions, I'm sure, to the best of our abilities. I've said before, I think as much alignment as possible is really important, but we also have to be prepared to do things based on what we consider to be in the best interests of those we represent. I mean, schools, for example, we need to look at the evidence in Scotland of what returning schools would do, and we'll say a bit more about this tomorrow. But also, just on a very practical level, our school terms are different. So that also is a factor that we will take into account. The business workplace guidance that the UK government is working on and has been shared with us and with trade unions and businesses in the last day or so. Again, I think that's a good starting point, but we will want to consult with businesses and trade unions here to see whether there's any adaptations of that are necessary. But the timescales of all of this have to be driven as far as possible by the data. If we take our foot off the brake on all of this too early, this virus will run out of control again, and we will find ourselves living with these very severe restrictions for much longer than would otherwise be the case. So all of us, I'm pretty sure, will make these judgments as carefully as we possibly can. I know that's the case for me, and I'm pretty sure it's the case for all of the other leaders across the UK. Peter McMahon from ITV Border.
Thank you, First Minister. I wonder if I could just make sure I understood an answer that you gave to one of my colleagues just a couple of questions ago. So you hope to have this scheme, test, trace and isolate, up and running by the end of May. And when you get there, will there not be particular problems in doing this in rural parts of Scotland, which of course would take in a large part of the south of Scotland?
Well, yes, there will be different approaches needed given different geographies. It will be a different challenge in the centre of Edinburgh or Glasgow than it will be in rural parts of the country, and that has to be part of our thinking. We will set out more detail of just the progress and the sort of milestones along the way, but by the end of this month we need to be in a position to deliver an enhanced TTI capability. Now, that doesn't mean that you get to the end of this month and that is it, because you will have to flex this capability depending on what is happening with levels of infection. We will start, as the paper says, with priority groups that are currently being tested. If you take the situation with the care home in Skye right now, there is contact tracing happening there in terms of some of the contacts of staff within that care home. So this will be an evolving situation. But by the end of this month, and please don't take that as a guarantee that we'll start lifting or changing lockdown restrictions then. There is a lot of water that needs to go under that bridge, but we need to be in the position to significantly increase the capacity we have for contact tracing, and that's what we're working on very hard right now. Alan Smith from Bauer.
Thank you, First Minister. You say an additional 2,000 contact tracing staff would be required for a sustainable service. Just wondering where these staff are coming from, and if you're looking at examples in other countries where they're using medical students or furloughed staff.
Well, we're looking at all of that right now. The starting point, of course, is BOR's looking at the assets and resources and human resources that they already have, and looking whether people can be trained to do this, but then also bringing in additional people, and that's the process we're going through right now as to who we can access to do that. And some of this will be straightforward recruitment into jobs that people will have to do. So that's the detail that we're working through just now, and we'll continue to update on that as we progress with it. Fraser Knight from Global.
Thank you, First Minister. As we hear about this outbreak in the care home on the Isle of Skye, this is yet another outbreak in a private care home. Many of these outbreaks are happening in private care homes. Some companies have multiple homes with outbreaks. I was wondering, do you have any concerns that some of these private companies are not following the guidelines properly or are struggling to contain the virus? Have you considered nationalising any care homes, and will these companies face any repercussions at the end of this?
Look, I'm sure on all sorts of things, when we come out the other end of this virus, there'll be things we look at and think, you know, do we want to change that for the future? And I'm not talking specifically here about care homes, I'm talking about society and the economy generally. But right now, the focus is on making sure we deal with the immediate challenges that this virus is posing for us. I'm going to hand over to the Health Secretary to say a bit more, as she did earlier on, just on the steps we're taking. I suppose I would say, just this thing, to preface that, we know this virus is particularly tough for older people when they get it. You know, not just in care homes, but the majority of deaths from this virus are in the elderly population. We also know that the virus spreads more quickly and aggressively in institutional settings where people are living together. And it is a hard reality, but nevertheless a reality that, you know, regardless of what we do, there will be an extent to which this virus is difficult to stop in those kind of settings. That's why suppressing it completely is what needs to be our principal objective. But it also means that the guidance that we have given to care homes must be implemented rigorously. That is the guidance on social distancing, on isolation, on the use of PPE, and we continue to work with the care home sector and public health directors and the care inspector that continue to do that to make sure that is the case. And also that we're using testing appropriately to try again to minimise spread in care homes. This is of the utmost importance and priority, which is why the Health Secretary took some time just to recap on the things we're doing, and I'll hand over to her again just to say a little bit more about that.
The only two things I think I would add to what the First Minister has said is, if I take you back to the guidance that was issued on the 13th of March, the point of that guidance was exactly as we have repeated many times, and that was to stop the introduction as far as we could of the virus into care homes. That's why visiting was halted, and also in the care homes themselves to try and limit the transmission of the virus if it did enter the care home from one resident to another. All of that requires both the following of that guidance, the right supply of the right kind of PPE, which is why we intervened to make sure that that was there, the understanding and knowledge of staff about the use of that PPE, and critically, about infection prevention and control. As you say quite rightly, I think around 70% of our adult care homes that care for elderly residents are private sector care homes. Our job is to provide them with the right clinical and practical advice that we can, and now with the Director of Public Health having that very clear clinical responsibility to ensure that as far as we can in every care home, that guidance is being followed. The staff are confident. Where we need to give additional NHS support, we are doing that in order to make sure that the residents there are protected, bearing in mind, as the First Minister said, that we are talking about generally an older group of people, many of whom have underlying conditions already and have a significant degree of frailty. So the risk to them of the virus is considerable. Our job has to be to try and work as hard as we can alongside the private and the independent sectors in our care home to provide all of that clinical and practical support that we are doing and have been doing for some weeks now.
Okay, thanks, Jeane. Anas Hassan from Kingdom FM.
Thank you, First Minister, and I'm grateful for the opportunity once again. Fife was one of 4 council areas in Scotland where local pilots of a citizen's basic income took place, and we're waiting for a final report from the government later this year. But given the major economic disruption caused to many people because of the current lockdown, how soon specifically can that final report be published? And following on from Spain's intention to introduce a similar sort of scheme there at the earliest possible opportunity, do you intend to introduce a universal basic income scheme in Scotland? And if so, when?
Thanks, Anas. To take the Fife pilot, first of all, which is one of a few pilots that the Scottish Government have been supporting councils to do over the last couple of years, inevitably, as with all aspects of non-coronavirus work, that will have been delayed and slowed down as people in the council focus their attention on dealing with the immediate challenges of the virus. But of course, we want to see that work, as with all work, get back on track as quickly as possible. More generally, and I've said it before at these briefings in the last week or so, the pilots should indicate that the Scottish Government has for some time been really interested in the concept of a universal basic income. We've always accepted there needs to be further consideration and exploration because there are cons as well as pros. But this whole experience of the virus and the economic consequences of that have actually made me much more strongly of the view that it is an idea that's time has come and that as one of the many things we need to fundamentally rethink, this should be up there quite close to the top of the list. As I said before, the Scottish Government can introduce it, unfortunately, unilaterally because it requires control over tax and welfare in a way that we don't yet have, unfortunately. So I hope that we can get into a constructive discussion with the UK Government about how we could explore and take this forward, hopefully reasonably quickly as we come out of the immediate crisis situation. So it's definitely a watch this space issue as we try to persuade the UK Government that this is something all of us should be showing much more interest in. Michael Blackley from the Daily Mail.
Hello, good afternoon. What is your current assumption for how long this TTI phase might last? How long will you need this enhanced testing capacity in place for? And your report makes clear that social distancing has to be in place. The next phase of the lockdown, is social distancing going to very much continue for the long haul?
Well, I'll come on to, the 2 points are related. How long will we need to have an enhanced TTI capacity in place? For as long as this virus is a risk that we cannot mitigate by treatments or a vaccine. And hopefully, we're seeing, or hearing positive soundings from the scientists about vaccine and treatments, but that for now remains in the future. So as I said when I published the paper a week and a half or so ago, until we get to that point, we are going to have to suppress this virus in other ways. And part of that, not the whole part of it, but part of that is an approach like TTI. And the other aspects of it will be continued social distancing. Now, I think it's important to understand that social distancing takes a variety of forms. Right now, we're in a very severe, strict lockdown. Even as you start to change some of that, continuing to make sure we're staying 2 metres apart from other people will continue to be important. Perhaps continuing, even as some of the lockdown restrictions might change, continuing to be careful in seeking to restrict the people we're coming into contact with outside our own households. All of those aspects of social distancing, and I'm not going to put dates on it yet, just as I'm not going to put dates on lifting any of these restrictions, but that kind of thing, the new normal of way of living our lives and going about our working lives is going to be with us for some time. Now, the end point of that, although it's maybe not accurate to describe it as an end point, but the game changer in that is if we get a vaccine or if we get a treatment that can really mitigate these symptoms. But until then, we have to suppress the virus. And if we're not doing it entirely as we are just now through the severe lockdown, we have to do it in other ways. But suppressing it is the absolute necessity, because if we let it run out of control again, we know the damage that will do. And some of the horrible numbers I'm having to report to you every day right now in terms of people dying from this virus would get much worse. So that's, I'm afraid, the reality that we're going to be living with for a considerable period of time. Christine Lavelle from The Sun. Oh no, sorry, my apologies. Simon Johnson from The Telegraph.
Hi. The document you published today, First Minister, says that TTI is most effective when levels of infection are lower than they are now. And I just wondered if you could provide some more detail on that, how much lower. And I also wanted to get some clarification on an answer you gave to Lisa Summers. Is it the case that we have to have this enhanced TTI in place before the lockdown restrictions can be eased? Or could the lockdown be eased first while this enhanced TTI is built up?
I know it's, trust me, I know this is quite frustrating because these things are not necessarily absolutes. As I've said before, the lifting the lockdown is not about flicking a switch. One day it's there, the next day it's not. And equally, TTI is not one day it's there or not there and one day it is. That will be built up and will have to continue to flex depending on levels of infection. So there will be an element of trying to balance things as we go. The more we become able, and remember this is not immediate, but the more we become able to change or ease some of these lockdown restrictions, the more we need to be able to kick in with other things and try to keep the virus suppressed overall. So it's always going to be a balance. Fewer restrictions, more TTI, and the more important social distancing will be, for example. So it's about keeping the right balance so that we keep it suppressed. And that is part of the difficulty of some of the judgments that fall to be made. In terms of the first part of your question, we need to get infection rates lower than they are just now. There's no kind of absolute, here's the R number that we need to reach or the levels of infection. We just know it needs to be suppressed more than it is just now. We'll say a little bit more tomorrow about where we think the infection is right now, and that will give you a sense of the level that we need to get it lower than. But what I would say is that will only happen if we all stick with these restrictions and resist the temptation to ease up or to have that extra journey outside or to maybe see somebody that we shouldn't be seeing. Every time any of us do that, we are risking the progress that we are making and pushing further into the future, the day when we'll be standing up here, not just talking about some of these alternatives, but actually introducing them. And now Christine Lavelle from The Sun.
Thanks, First Minister. Minutes from your COVID advisory committee say that your experts have received details on how the virus is transmitted in hospitals and care homes. Are you able to say what the R number is in those institutions? And just for clarity, are you confirming today that we're staying in lockdown until at least the 28th of May?
I can't give you the R numbers in care homes and hospitals right now. That is something we continue to monitor and try to, through modelling, get to as accurate a picture of as possible. What I think I can say with some considerable degree of certainty is that it is higher in care homes and probably hospitals too than it is in the community. And so while we are fairly confident that in the community the R number is below 1, although perhaps not much below 1, I think we are equally confident that it is still above 1 in care homes and possibly in hospitals as well. And in terms of we will take formal decisions when we get to the review date, and I will communicate those decisions. What I'm doing today is giving indications of a couple of things, because I think it's really important to be open and transparent. I cannot foresee the circumstances right now, based on the evidence I'm looking at, and which I'll share some of tomorrow, me being able to stand up here on Thursday and saying we're lifting elements of lockdown in any meaningful or significant way at all. And if I know that right now, then I don't really know why I can't share that. And I think actually I should be sharing that with all of you, because it's impacting on how you're living your lives. I'm making the factual point that the legislation requires us to review this every 3 weeks. So the next review date will be the 28th of May. That doesn't mean if the evidence says it was safe to do so, we couldn't make changes before the 28th of May. But the next planning period will be that 3 weeks from the 7th to the 28th of May. And the evidence then will drive whether or not there's changes that could be made within that 3 week period, at the end of that 3 week period, or not. And so this is going to continue to be a very iterative process. And in the interest of transparency, I also have to say I can't say for certainty right now whether before the 28th of May or on the 28th of May I'll be able to say we're easing anything. But I'm pretty certain right now, albeit the formal decision hasn't been taken, that I'm not going to be able to announce any meaningful changes at this point, which will be on Thursday, the 7th of May. So I'm trying to be as open and upfront as possible. And as I keep saying, sometimes that openness means sharing the uncertainties with you as well, in the hope that you're better able to understand what I'm asking you to continue to do. Jeane Davidson from The Scotsman.
Good afternoon, First Minister. In terms of your TTI, Linda Bald, who's a Professor of Public Health at Edinburgh University, said the government has been very slow in increasing the capacity to carry this out in terms of staff numbers. She says that Public Health England has already been advertising for staff. Has the Scottish Government done any advertising yet? Is it planning to recruit people? How many of those will have to have clinical experience, and how many will just be people that can pick up the phone to help contact people?
I'll be advised by experts on the clinical mix that will be required for that as we go along. As I've said already today, work is already underway with health boards looking at their current staffing complement and how they can enhance contact tracing from within that. Over and above that, there will be a requirement to recruit additional people, and that process will be getting underway. I don't think it is fair to say that the Scottish Government has been slow on this. This is not an easy process. We have been focused very heavily on increasing our testing capacity, which I was able to report progress on Friday, and all of this work is being done at pace. If I can remind people that we've gone from a position at round about the start of March to having the capacity in Scotland to process 350 tests a day to now being in the position where this time next week we'll be able to do 10,000, and by the middle of the month 12,000. That is significant, very rapid progress, but we need to do more of it, and we also need to match that with recruitment of contact tracers, and that's what there is a significant focus on right now. Severin Carell from The Guardian.
Can we just thank you, First Minister. Can we just get some more clarity, please, on the point at which TTI may actually be introduced? You say that there's going to be some flexing between the lockdown and the use of TTI. Are you saying that TTI could start in Scotland before full capacity comes into place at the end of May?
In short, yes. I mean, I'll use the same sort of kind of language as I've used around lockdown. This is not, don't think of it as one day we flick a switch and we go from no TTI to having full capacity. It will build up over the weeks to come. As I said a moment ago, if you take Skye, for example, right now there is contact tracing being done in terms of the outbreak in that care home. So boards will use contact tracing when they consider it appropriate right now, and then we'll build that up and build the capacity we've got to do up in the weeks to come. And beyond the end of the month, it won't be the case that we get to the end of this month and that's as far as we will go with capacity. We will need to be prepared to build it up even more if levels of infection demand it. The capacity you need for a system like this depends on the levels of infection. If you've suppressed this infection so much that very, very few people are getting it, particularly over the summer when there's fewer other viruses that result in the same symptoms, you'll have very few people to test. But if infection levels are higher, or perhaps as you go into the winter and more colds and flus are around, you'll have more people that you need to test. So the ability to flex this capacity as required will be really important. Jason, do you want to say any more about it in terms of the practicalities?
Only that health protection teams are very used to doing this. Health protection teams across the world and in Scotland track, trace, test for other diseases, sexually transmitted diseases, for instance, or Ebola would be the more recent example. Very, very small numbers of cases that we traced. So health protection teams have the clinical knowledge, and much of the judgment is clinical. So the Skye example is because the Director of Public Health, knowing the locality, talking to the clinicians and the staff there, decided contact tracing was an appropriate clinical step to take in order to protect the residents and staff within that setting. What we're saying now is we want to ramp that up at a national level with the Directors of Public Health helping us with their health protection teams to do that more broadly across the whole country.
Thanks, Jason. Vivian Aitken from The Record.
Good afternoon, First Minister. Sorry. A couple of things I would just want to ask about testing. Currently, we have a capacity for about 8,500 tests a day between NHS testing and UK government testing. Can you tell us the most recent figures for the uptake of those tests? And also, you're talking about increasing capacity to 15,500 as part of Test, Trace, Isolate. Can you tell us where that extra 3,500 tests are going to come from?
Well, the extra tests will come from effectively the same mix that we have managed to increase the testing capacity from. Remember, this is capacity, so this will be additional machines and staffing in existing NHS labs, looking to see if we can utilise more academic capacity, looking for commercial partnerships. So that's basically what we've been doing to increase capacity thus far, and we will continue to do that. In terms of the overall testing figures tend to dip a little bit over the weekend. We will later on publish the total for yesterday, which I would remind you will be a combination of the number of tests done through our NHS labs, which is the figure we've been reporting up until now, but adding to that the numbers that will have gone through the drive-through centres or been done through the mobile units that are there, and we will publish that combined total later on. Tom Martin from The Express.
Hi, good afternoon. Thank you, First Minister. Today's document talks about the need for close contacts to isolate, and obviously it mentions as much as possible isolating away from other members of their household. The document also recognises that's not always going to be possible, and you may have to help them find somewhere to isolate. I just wondered what initial ideas you have of where these people could go. Would it be a hospital setting, or would you have to look at sort of commandeering hotels to help quarantine and isolate people? And what sort of circumstances would that be in?
So I don't want to set kites flying here before we've really got to a point where we're certain about some of the things we have to do, and that's the detail we're working through right now. But the kind of things you're talking about could well be the kind of things that we have to consider. And basically, if we're asking somebody to isolate for 14 days away from the rest of their family, that's fine. If you live in a house with multiple bedrooms, it's less so if you don't. So if you live on your own as well, it raises questions about how do you get essential food and medicine. So there's some learning we've got here in terms of the arrangements we've put in place for the shielded group that we can draw on. But there are more fundamental issues that we have to work our way through. And I'm flagging that up openly today, just as one of the difficult things that we have to consider here. And one of the reasons I'm doing this is because, test, trace, isolate, there's a lot of focus on the first two aspects of this, on testing capacity, on tracing capacity, and rightly so. There's probably been less focus on the isolate part, and in actual fact, that is possibly for the public. I mean, it's for government to work out and make sure we've got the testing capacity and the tracing capacity, but the bit that's going to be really tough for the public is the isolate part. And remember, we may, if you're contacted and told that you've been in close proximity to somebody with this virus, you might not know who that is. It may not be somebody you're aware of having been in contact with, but you're going to be told to isolate. You may do that for 14 days. If the person turns out to be positive, you'll isolate for 14 days. You might then go back to work for a week and be contacted again and told, actually, there's somebody else that's got... Now, that's all hypothetical, but it's not impossible that all of us will find ourselves being contacted and told to isolate, perhaps on multiple occasions. And I'm not saying this to kind of alarm people or scare people, but it's really important to get people thinking about the practical implications of this, because it will only work if it has your confidence and your willingness to comply. It's also why, in due course, some of the technological elements of this, I mentioned the proximity app, which I think used properly with the right confidence levels in the public will be a really important part. It will speed up the whole contact tracing. It will alert people directly. But if people don't have confidence in an app, if they're worried about privacy, if they're worried about what happens with data, then we're not going to get the uptake levels that would make that possible. So, as Jason said a moment ago, all of this, every aspect of dealing with this virus involves me as a politician standing, asking you as the public to do things that you've never had to do before, that upends your life and makes fundamental changes to how you live your lives. And for you to have the confidence to do that, to trust what I'm saying to you, I need to be really open with you about the complexities and the challenges and what we're doing to work our way through. So that's why at a fairly early stage, still at a fairly high level, we're publishing this paper today, because I can't make TTI work without your cooperation and compliance. And I only have a right to ask for that if I'm open and honest with you about what we're doing to build it and what I need you to do as well, and be frank about some of the challenges in that. And that goes back to what I said a couple of weeks ago. This is all really difficult. And we have to have this conversation in a two-way form where I'm honest with you and don't demand your trust in what I'm asking you to do, but demonstrate through that openness that I'm not asking you to do anything that is not essential for suppressing this virus. And that's what I really need to try to continue doing if we're to get through this together with all of the difficulties along the way. Kieran Andrews from The Times.
Thank you. In Scotland, I think we have more than 1,000 care homes, around half of which have had an outbreak of the virus that includes many where staff have been absent. Do the 234 returners that have been deployed or requested enough to plug those gaps and provide the additional support that is required to deal with the virus in care homes?
To answer that point, can I just remind people, this is not to diminish the importance of this at all. I hope nothing that we said suggests we're doing that. But just to remind you of what we class as an outbreak. So when we say 40% of homes have had an outbreak or have a current outbreak, that may just be one resident who has it. In many cases, it will be more than that. But it's important that we're clear about what we mean about that. Jeane, do you want to take the staffing point?
Yes, thank you. So you're right, 234 of those just under 3,000 individuals have already been deployed into the care sector. Another 305 are ready to undertake that work. For that to happen, we need care home providers and others to notify us that they have those gaps in the areas where we have those staff, and then we can make that happen. But as I speak, others are going through the pre-employment checks. So we do all the pre-employment checks work to make sure that people have the skills that they tell us when they volunteer they have, that we've done the secure checks on them too, because they're going to be working with vulnerable adults, so they are ready to be deployed. And we're working our way through all those others, but those numbers are there already. And the final point I'd say is this. Some briefings ago, people may recall our Chief Nursing Officer talking about asking our NHS staff to deploy themselves into this sector, where we need their particular additional clinical expertise and their experience, especially in infection prevention and control. And as I said at the very outset, for that particular care home in Skye, we have already undertaken that and provided that additional NHS support to that particular care home, and are ready to do that elsewhere in the country on top of the places we've already provided that up till now.
Thanks. Alistair Grant from The Herald.
Hi there, thanks very much. Just in relation to the app on people's phones, is the Scottish Government expecting to be part of any public information or advertising campaign to encourage people to download this app? And what percentage of Scotland would need to download it for it to be effective?
I said earlier on, and I don't want to confuse people, not least myself, with talking about different forms of technology, but in Scotland, we are trying to build a digital system that allows this to be automated. But the app you hear about is in the UK. It's an initiative being led by the UK government. We've had discussions with the UK government. We're trying to maximise our involvement and input into the development, because I think it is so important that we get all aspects of this right from the outset. And we haven't yet got to the point of seeing or knowing exactly what, well, I certainly haven't, of what an advertising marketing campaign would be. In terms of uptake, this is not a Scottish figure necessarily, but the figure I've seen that suggests that the percentage of the population that would have to download the app for it to work as intended is, I think, around 60%. Now, that's a fairly high uptake, and I think the thing that is uppermost in my mind when you're talking about technology of this nature that effectively tracks people, will tell whether two people have been in close contact with each other, you have to have significant levels of trust in the privacy elements and in what happens with data. And I think it's going to be really, really important to do that carefully if we're going to get to uptake levels like that. There's no doubt in my mind that done properly, with that level of public confidence, this can be a really important part of how we implement TTI. but I would be very cautious at the moment about, and that's why we're not doing this in Scotland, about building the whole system around it. I think it's something we want to add on to it as an enhancement, not become the foundation of it. Do you want to say any more about the technology, Jason?
I agree with you that the app, this contract tracing app, and we've seen it used around the world, it needs high levels of download, it needs high levels of digital literacy, in fact. So we have to be careful that there will be some people who will find it impossible and there'll be other people who choose not to do it, which is why we need traditional, slightly old-fashioned contact tracers. These are people who will phone you up and they'll say, where were you in the last days? Who did you see? Who were you beside? It's quite a skilled interview process. Again, the health protection teams are very used to it. They will train the new people to be able to do that. If we can add a contact tracing app in there somewhere that allows us to do that digitally, then all the better. But we shouldn't be completely reliant on it. That simply won't work.
I mean, even the traditional, as Jason called the old-fashioned contact tracing on a mass scale is asking people to share private information. I'm not suggesting people are, with people they shouldn't be with, but private information, getting into how people are living their lives. And this is not something that most people are familiar with, which just underlines this point here about very carefully building up knowledge and confidence in how a system like this would work. And that's going to be so important. And it comes back to why we're publishing this paper today. Doesn't answer every question you will have about this, but it starts to set out how it will work, set out some of the issues we have to overcome, and so that together we're developing this in a way that you as the public are confident in and are then prepared to use in the way that you will need to use it if it is to be successful. Tom Peterkin from the P&J.
Good afternoon, First Minister. The Labour MSP Rhoda Grant has said that a constituent raised concerns about the impact on the virus on the home farm care home on Skye back on March 26th. Does this not suggest that more should have been done to prevent the spread of the virus, and why was there not earlier mass testing?
I don't know what Rhoda Grant is referring to, but I'd be very happy to look into that if she or you want to pass the details on to me. We have taken the care home situation very seriously from the outset. The guidance that was published or sent to care homes on the 13th of March gave the advice on isolation and social distancing, and at every step of the way we have been absolutely rigorous in looking at what we need to do to minimise the infection getting into care homes, and then if it does, to try to reduce spread. And it involves the government, health boards, public health directors and care home providers working together in very close partnership. I suppose that the final point I would make here, and again, I certainly hope nobody takes this as me in some ways suggesting this is not an absolutely serious and priority issue, but all countries are finding that this virus is a particular challenge in care homes. And therefore there is something about the nature of this virus that is presenting that challenge. That doesn't make it any less important that we find as many ways of beating it and stopping it getting into care homes as possible. But equally, I think it is really important to just understand the nature and the scale of the challenge that the virus itself presents in that kind of setting. And final question today is Derek Healy from the Courier.
Thank you, First Minister. Just to touch again on that UK government plan for workplaces as the lockdown restrictions are eased. Again, we're expecting that to be published on Sunday. Just to ask, how involved have the Scottish Government been in shaping that plan? Have you seen it, and how closely would you expect Scotland to follow it?
There have been conversations and discussions. I believe I'm correct to say that it was only shared, the draft were only shared with the Scottish Government yesterday. So we are looking carefully at that. We will want to do our own consultation with trade unions and with businesses in order to assess whether in its current form we would be satisfied to have that as guidance that the Scottish Government endorsed for Scotland, or whether there were changes and adaptations we wanted to make. Certainly I think there will be a lot of very good suggestions in it, but it maybe I've seen already this morning some trade union comments that feel it needs to be a bit stronger than it is. So that's an assessment that the Scottish Government will be making in the days to come. I think, and again, I think all governments are in the same position here. It's really important as we go that we are building confidence and trust in people. If I have to stand here, and I hope at some point in the not too distant future, although I keep saying not imminently, but at some point in the not too distant future, if I'm standing here saying go back to work in certain circumstances or send your children back to school, you need to know that I can say to you confidently that it's safe to do that. And you need to have confidence that it's safe to do that. So this work we're doing right now to prepare for the basis on which we can get things back to normal is so important. And it's not ever going to be enough for any government just to say, this is what's happening and you have to comply with it. Because if you don't have confidence that it's safe, you won't do it. So we have to, at every stage here, get as much public buy-in and consensus for this as possible. And that's the task we're all engaged in. And it's one that we will continue to try to work very hard on, both on workplace guidance, but on all of these other issues that we have to confront as we try, as all of us want to do, to get back to normal as quickly as possible. Thank you very much to all the journalists. That concludes the questions for today. My thanks to Professor Leitch and to the Health Secretary. My thanks also to Jill, our sign language interpreter for today. Our sign language interpreters are so important to make sure that these briefings are as accessible as possible. So I'm very grateful to them for the hard work that they do every single day for us. We'll be back here at the same time tomorrow. As I said, we will set out tomorrow a little bit more about what we know about the state of the virus in Scotland right now, what that says in terms of what is possible or more likely not possible on Thursday at this review point, but also give an indication of some of the work we will be doing over the next few weeks to try to make sure we are in a position to restore some normality as soon as the evidence tells us that it is safe to do so. And my last point is just a plea, if you can. I said a couple of weeks ago, I know most people don't ever read government documents, and here we are in the space of 2 weeks with me asking you to read a second one, and I'll ask you to read a third one tomorrow. But if you do have the time, go onto the Scottish Government website and read through the TTI paper. It's not very long, but it gives you a sense of what this system would look like, because as I said earlier on, we will all have to get our head round how these things work, because they will only work if we are all prepared to do what they require of us. So thank you for your time and your patience today, and we will see you back here tomorrow at the same time of 12:30.